name is Telaine Mitchell. I'm a PT1 at Nova Southeastern University. This is my patient Janice. I just want to make sure we have your consent to record our session for educational purposes.
Yes.
Okay, the first structure we're going to locate is the supraspinatus. In order to do that, we're going to locate the spine of the scapula, which is about here. We're going to come slightly superior to that where the muscle is. We don't want to go too far that we're on the upper trapezius muscles. So we're going to keep my fingers here. I'm going to have my patient flex her arm in 30 degrees of the scapular plane, and then I'm going to give slight resistance and push down, and we can feel the muscle fibers contract in my fingers right there. From there, we're going to locate the lateral epicondyle. So if we just come distal to the humerus, this first bony protuberance right here that pops out is the lateral epicondyle. From there, if I slide my finger down just posterior to the lateral epicondyle, we're going to be in a groove here, which is the radiohumeral joint. In order to verify that I'm in the correct location, I'm going to have my patient pronate and supinate her hand. So supinate, pronate, supinate, pronate, and you can feel the radial head move under your thumb, and you know that you're in the right location. Okay, so the next structure we're going to locate is the triceps. First, we want to locate the olecranon, which is right here. We want to note that the triceps come from the part of the scapula all the way down. So in order to verify we're in the right spot, I'm going to put my hand here, have my patient extend her arm and press back, and I'm going to give resistance, and the fibers are popping out right into my hand. Okay, the next structures are going to be the deltoids. We have the posterior fibers, the middle fibers, and the anterior fibers. There's a common insertion point for the deltoids, which is the deltoid tuberosity. To make sure that it pops out more, I can have my patient abduct and raise her shoulder, and we have the deltoid tuberosity here right where the fibers end. In order to do the muscle actions for each of the deltoids, the first one for anterior, I'm going to have my patient flex her arm, give resistance, and the fibers pop out there. For middle, I'm going to put my fingers right here, right where the muscle is. I'm going to have her lift her shoulder out to the side, give resistance, and the fibers pop out there. And for posterior, I'm going to have her push her elbow back, give resistance, and you can feel the fibers there. The next structures are going to be the biceps. With my patient's arm flexed in 90 degrees, handed supination, I'm going to give slight resistance and put my fingers here to feel the fibers contract, and you can feel them contract right there. From there, we can pronate her hand this way, feel the fibers that are just distal to the biceps right here, and I'm going to do the same motion, press down, and the brachialis muscle is right here. And then finally, we have the brachial artery. If we find the tendon, go slightly medial to the bicep tendon, we should feel the pulse there.